Hello, my name is Miss Hui-Ling Kerr. I'm one of the orthopaedic spine surgeons based in Gloucestershire, and I treat people with spine conditions such as sciatica, neck and low back problems, spine fractures, spine tumours, and spine injuries. I always found working with people my passion, and I have great compassion for people suffering in pain and difficulty. I was lucky enough when I was a young person to be guided in the right direction to do medicine. And in this profession, I get to help people with such problems. A series of the right opportunities and decision making led me to become the doctor I am today. Once I qualified as a junior doctor, I soon realized that I enjoyed the practical procedures the most, such as things like suturing and fixing fractures as a trainee. And I was also amazed about the transformative outcomes surgery can have for patients. I eventually found orthopedics to be my passion, and spine surgery within orthopedics itself is the most exciting, magical, and rewarding of all the surgical specialties. For me, spine surgery is the only specialty where through proper diagnosis and surgical technique, we can give a patient who has been crippled by low back pain or neck and full body dysfunction to an ability to walk and function again. I have found also that when a patient is freed from their pain, their carer is also freed because the patient has regained their independence. For me, the fact that two people have been freed from servitude is truly amazing. When I've completed an operation to my satisfaction with low or no complications, this is a wonderful thing. And also when I see a patient at 6 weeks follow-up and I see the joy in their face from being able to walk again or function again or go back to work and also to be freed from pain, there is nothing to replicate that feeling in the world. And this is what brings me back to being a spine surgeon. It is for me the best job in the world. I think my patients value my kindness and professionalism. They value my honesty, and they know I will always try my best for them. In general, I'm considered to have excellent technical abilities. I have a low complication rate and generally have good results. I try my best to be professional and kind in the theatre environment. I won an award recently for civility in theatre, with comments from my nursing colleagues to say that I generate a calm and positive working environment so that operations tend to go smoothly with great teamwork. Therefore, I try my best in all aspects of spine surgery to help my patients and help the team so that my patients can have the best outcome. I also value honesty from my patients and for them to try hard with their health too. Sometimes I have to have difficult conversations with them in order for them to help improve their own health so that they get a better outcome from spine surgery. This can include asking them to lose weight or stop smoking. And I find that the ones who do often come back to my clinic looking 10 years younger and generally are fitter overall and have better outcomes from spine surgery. So the important thing for me and for spine surgery is not just about the technical parts of surgery itself, but looking at the patient as a whole, as an individual. My mantra is preparation is the enemy of defeat. I like this mantra because I've used it throughout my career in order to get across hurdles such as exams and interviews. We have similar sayings in orthopedics, plan to fail, fail to plan. But I do really like the phrase, preparation is the enemy of defeat, because it is so true. If you don't plan properly for the spine, the complexity of the anatomy and the difficulty of the surgery can overcome the unaware surgeon. I was told by an industry rep recently that I am the most prepared spine surgeon she has ever met. For me, this is probably the highest praise I've earned from someone in industry. It's even a higher accolade than winning an award at a conference or a prize for a publication, because for me, it's vindication that I'm doing the right things for my patient and the team.